So my name is Dr. Ali Khan Lalani. I am a medical oncologist at the Juravinski Cancer Center and assistant professor at McMaster University. In brief, the summary of the CYTOSHRINK trial is that this is a randomized phase 2 study of patients who have de novo advanced renal cell carcinoma, essentially metastatic disease with the primary in situ. All patients who are eligible are randomized in a 2-to-1 fashion. The standard arm is the receipt of combination nivolumab and ipilimumab per standard of care. And the interventional arm is to receive SBRT to the primary kidney mass in between cycle 1 and 2 of combination nivolumab and ipilimumab, and then the remainder of systemic therapy per standard of care. We have interesting correlative endpoints where samples will be collected at baseline, the start of cycle 1, cycle 2, and at the 12-month mark or progression. The genesis for the CYTOSHRINK trial came on the heels of two key points in the treatment of kidney cancer. One was the introduction of combination immune checkpoint inhibitor for first-line treatment for patients with advanced disease. And the second key point was the outcomes from the Carmina and CYRTIME trials, which showed that patient selection was key in proceeding with so-called upfront cytoreductive nephrectomy. And so for patients who present with de novo advanced RCC, the CYTOSHRINK trial was envisioned to provide upfront systemic therapy with contemporary immune checkpoint inhibition, while also allowing patients to receive cytoreduction from a radiation perspective, SBRT, which offers a convenient short course of radiation. So this phase 2 randomized trial attempts to evaluate the benefit of radiation to the primary tumor mass in patients with advanced disease, all of whom receive combination immunotherapy. Eligibility for the CYTOSHRINK trial again include patients who have no larger than a 20 centimeter primary kidney mass in the context of stage 4 disease, have no preclusions to receive abdominal directed SBRT to the kidney, and are eligible per standard of care labeling and investigator discretion to receive combination checkpoint inhibition. Importantly, this trial is allowing any RCC histology per labeled indication in the jurisdictions included, and so that could include clear cell or alternate variant histologies as well. In terms of our outcomes or endpoints of interest, this randomized phase 2 trial will evaluate progression-free survival as a primary endpoint, and this is based on the hazard ratio of PFS, looking at the 12-month mark. Other important endpoints obviously will include safety and tolerability, overall survival, among others, very standard clinical endpoints. I would make mention of some of our correlative exploratory endpoints that will be evaluated, which include looking at baseline and changes, dynamic changes in blood biomarkers, as well as the gut microbiome. Again, these samples are collected from patients at baseline and the start of cycle 2, as well as at the 12-month mark or progression, whichever comes first. And this will also be contextualized against the baseline tumor biopsy, and because downstream cytoreductive nephrectomy or completion nephrectomy would be allowed, perhaps integrating a subsequent nephrectomy tissue sample as well. So we have very interesting clinical and correlative endpoints in this innovative trial design. I think this study will be of interest to RCC patients and the wider RCC community for a variety of reasons. One, this is a prospective randomized phase 2 trial evaluating SBRT to the primary kidney in the context of contemporary immunotherapy. And importantly, we have now seen the 5-year follow-up data from Checkmate 214 really showing durable responses, important clinical benefits for patients. Further, on the heels of the CYRTIME and Carmina trials, I think we have rethought of the role of cytoreduction in the form of surgery for these patients. And so evaluating cytoreduction in the form of radiation will be really a novel concept to test prospectively. And one can envision many de novo patients potentially availing of a non-invasive treatment so long as it's safe, tolerable, and beneficial. So I think this is a very important trial that has a lot of interest in evaluating it, again, in a prospective way for a treatment that may have been occurring in many centers off protocol anyway. So I do think this has high clinical interest, and certainly this could spur many questions about using different types of systemic therapy with radiation, so-called synergy, and this is where I think our correlative endpoints may be revealing as well. Recruitment is ongoing, and we must give a shout out to all the investigators, their trial teams in the face of COVID and disruptions which have affected globally clinical trials everywhere. The CYTOSHRINK trial is still ongoing, strong, has now recruited over 30% of its recruitment target, and that's excellent in the face of many restrictions we've had at centers in Canada and Australia where this trial is occurring. So it is expected that recruitment will be robust throughout 2022 and likely close throughout 2023 and then enter into an analysis phase.